Hey, what's up everyone? So today I'm going to talk about my psych rotation, so let's get to it. So my psych rotation was awesome. I loved it. I loved every minute of it. I've decided that I'm going into psych. I will make another video about that soon, so be on the lookout for that. So what my psych rotation was, it was 5 weeks. 4 weeks, about 4 weeks was outpatient. Just straight up outpatient clinic with third-year residents. Just chilling, getting there around 9 a.m. And leaving around 3. So like very laid back. We would see 5 or 6 patients a day. Like just very cool. Like we would see everything from borderline to bipolar to schizophrenia to anxiety and depression. The whole range of outpatient clinic, from kids to geriatrics. It was awesome. That's what I want to do, so obviously I loved it. And then I spent 1 week of inpatient. This was consult clinic, so anytime a patient is there for another reason but needs to be there or needs to be seen by a psychiatrist, they would call us and then we would go and see them. So on those days I was only seeing 2 or 3 patients a day, but I was there I think pretty much longer, from like 7 to 4. So that was like really like twiddling my thumbs for the most part, just waiting for somebody to call. But it was ran by physician assistants or physician associates. So it really won't be what I'm going to do, but it was interesting and I enjoyed the time. It was seeing that kind of environment that they practice. So that was really cool. So like, what did I do? So because I expressed that I am interested in psychiatry and that I'm going to be going into psychiatry, I feel like they let me do a lot. And like when I say a lot, I mean like interviewing the patient almost completely by myself, recommending medications, and they would just take me for it. Which was definitely a overwhelming task at the beginning, but by the end of the 5 weeks, I really felt comfortable doing it. The attendings loved that I could do it. The residents really helped me out and taught me how to do certain things. Obviously, I don't know what I'm doing for the most part, but it was fun to get to, try. So that was really cool. If you let your residents know that you're interested and that you want to challenge, they will definitely let you run the entire interview, close the interview, present to the attending, and make recommendations. So that was really cool. Some of the stories that you hear in outpatient psych is just phenomenal and exciting. And some of them are just outrageous. Like it really is. Like some of them are just so cool. And some of them are just very strange. So like, get ready for that. It'll be awesome. So for the shelf exam, I thought the shelf exam wasn't super easy actually. Like obviously I'm very interested in psych, so I felt like the material was going to come easier. And I only used UWorld. I did UWorld twice completely for the psych questions, and then I used some AMBOSS questions as well. And I was doing really well on those, like really well, like being about 80%. And then I felt like the actual shelf was a little bit harder. They asked a lot of very specific questions that I felt like UWorld didn't really discuss, or they talked about management of things, which I feel like UWorld didn't really discuss. It wasn't my best shelf grade. Like most people think that psych will be their best grade, and I feel like for my class that wasn't the case. I feel like they've definitely made it harder. So just be prepared for that if you're looking to honor the course. You definitely need to put in more work. It's not a breeze rotation like I feel like a lot of people think it is. The hours were definitely super nice, but I feel like the questions are easier, but you got to do really well to do well on the like percentile wise. To study, I told you I just did UWorld and AMBOSS, so that's all I would recommend. You learn a lot from just the interactions with the attendings and the residents. They like to tell you what you need to know. And then another portion of our grade was we had an OSCE, where we had a standardized patient, and you had to interview them, and they evaluated you on your ability to communicate and show empathy. And I feel like that is pretty easy to do, especially you've probably done OSCEs up to this point. Like it's just the same thing, but just in a psych patient. To do well, show that you're interested, show that you want to be there. A lot of patients can definitely feel on edge having a student in the room. If you just feel friendly and show that you're friendly, that goes a long ways, not just in the patient's eyes, but in the attendings and the residents' eyes, and they're the ones that evaluate you. So that's all I got. If you have any questions or comments or want to see any other videos, drop it down in the comment section below and I'll get to it. Thanks guys. See you later.